to Freshly Forever, a podcast that gives you fascinating insights week after week. Here's your host, Vi Kumar.
Hey folks, welcome to another episode on podcast Freshly Forever. Today I have the pleasure of talking to Dr. Neetu Bajekal. She is a gynecologist with over 35 years experience and has written a beautiful book, Living PCOS Free. Hey, Dr. Neetu, welcome to the podcast.
Thank you. Thank you. It's so kind of you to invite me. And I'm so happy to connect, actually, because I'm so passionate about what I do. And I would love to talk to you about, women's health and reproductive health and anything else that you want to know.
Oh, absolutely. So why don't we get started with basically the menstrual cycle, and if we can reflect some on period pain and what are the causes of it.
Okay.
I think that'll be a great starting point for listeners.
Absolutely. So I want to start off with in the podcast to say when I use the word women or woman, I mean anybody who's been assigned female at birth. Because not everybody who's assigned female at birth will identify as a woman later on. And so that's really important clarification to make. So it's important that health professionals use the right terms as well. So the menstrual cycle is a very fascinating time. And basically, most women will start their periods between the ages of 8 and 15. And if there is a delay in the cycles, it's really important if you are the person who's listening or if you have a child who's, 14, 15, generally, I would say just touch base with your doctor. So you may just need reassurance because there are some people who are late starters, but sometimes it can be a signal that there may be an eating disorder or something else, a genetic issue, and so some structural problems and things like that. And we do see that on many occasions. So it's really important that you know that the average age of starting menstruation is about between the ages of 12 and 13. It's starting to drop over the times, and there's a number of reasons: better nutrition, perhaps some endocrine disruptors that we come across now in our environment and diet and in water and things like that, but mostly to do with better nutrition. That's why menstruation is happening a bit earlier. While menopause remains a sort of similar age between 45 and 55, when you completely stop your periods, with that most common age being 51. So once you've started your periods, the first year it is okay for periods to be a little bit hit and miss. So you might skip a period here and there, but it's never normal to leak through your clothes, have flooding, clots, pain that stops you from going to school, missing periods for 3-4 months. That's not acceptable. And especially after the first year, if you're hopping and skipping periods, then that is quite important that, help is sought. So the menstrual cycle tends to be between 24 days and 35 days. That is the normal. But usually a woman will not have a period of 24 days this month, next month 35. Usually it'll be 24, 25, 26, 27, 28 days. Or another woman might have 28, 29, 30, 31, 32 days, or 30 to 35 days. It doesn't swing hugely between 24 and 35. So it's important to track your cycles as soon as they start. There are lots of free apps. Anybody who has a smartphone will have a free app on it. Otherwise, a good old-fashioned diary will allow you to keep that record. So between 24 and 35 days is when you expect your period to come, and no period should last more than 7 days. If it is lasting for more than 7 days, one has to really question why that is so, because that may be that you're having then heavy periods. There may be other things like polyps and fibroids that are making you continue to bleed for a longer period of time, hormonal fluctuations, all kinds. So very light periods, usually not a concern. If you have a period for a day or two, that's absolutely fine. But very heavy periods, flooding, leaking, passing clots, or periods lasting for more than 7 days do need attention. It might be that you just need reassurance with a blood test, maybe a pelvic ultrasound scan, but it needs to be looked into. So 24 to 35 days is the menstrual cycle. Periods lasting up to 7 days, not affecting the quality of your life, because we know that up to 2 weeks is lost in a woman's life every year from painful or heavy periods. And that is just from not being able to get out of bed and things like that. And while there may be primary dysmenorrhea or painful periods on the first or second day or just the day before is usually doesn't have a medical reason. It's because of a release of chemicals called prostaglandins that get released as the lining of your womb gets shed. So every month when the lining of the womb gets shed, along with it is shed a whole lot of debris and and vaginal discharge, and these chemicals called prostaglandins. So that's why you'll hear that sometimes we have nausea, we have vomiting, we have pain, we have heavy periods, we have constipation, we have diarrhea. These are because of the effects of prostaglandins on the way we react. So it's almost like, like a uterine migraine prostaglandins cause. And so we know exercise, hot water bottles, heat and cold treatment, yoga, exercise, eating more plant foods, all these help. But many young women will need medication such as Nurofen or non-steroidal anti-inflammatory drugs because they work against the prostaglandins. And you need to take it only for a day, but you have to take it starting the day before or as soon as you see the period start. You don't wait for pain to start. If you wait for the pain to start, then you need higher doses and the drug doesn't work. And paracetamol does not work for period pain like non-steroidal anti-inflammatory drugs. I'm not sure what they're called in the US, but ibuprofen, Nurofen, mefenamic acid, that group of drugs. Okay, and they should always be taken after meals, and you probably need a day or two of it. But if you're not able to go to work or go to school, you're missing exams, then, and in spite of taking these simple measures, you certainly need to be seeing your doctor because you may need further investigation, checking that you're not anemic, as well as you might have to be prescribed medications that can actually help you to live a normal life. And that includes the combined hormonal contraceptive pill, which is not just for contraception. It has got so many other non-contraceptive benefits that may have to be discussed. After discussion, it should be used. Of course, with teenagers, we're a bit more careful because some studies have shown that mood changes may be worse. But, it's always about balance, isn't it? It's about understanding. And that's important to know because although I'm a lifestyle medicine physician as well, I'm also a surgeon and OBGYN, and I've been doing this for 35 years. And I want to make it very clear to your listeners that there is no medication shaming. There is no shame in having surgery. There is no shame in taking things from the Western medicine because there are a lot of advances that really help us. But at the same time, we have to find ways of helping ourselves as well. It's not one or the other. Both things go hand in hand. So that's the menstrual cycle. But the other important thing why it's really important to understand is that periods are a vital sign. So if you are having periods and you're missing periods or they're coming too frequently, when you go to the hospital, just like when you have your temperature, your heart rate, your blood pressure, your breathing is checked, the 4 vital signs. Periods, the American College of Obs and Gynae and the American College of Pediatrics say that really it should be considered a vital sign because if
you call it the 5th vital sign in your book.
Because if you break your leg, for example, and you're a young person, you may be missing out. Just checking whether they are pregnant is not enough. It may be that they have an eating disorder, they are exercising too much. Maybe they have a medical condition that makes their bones brittle. If they're approaching perimenopause and menopause, they may be having osteoporosis. So if you don't ask this very vital question about periods and actually think as to why you're asking as a health professional, you're doing the person a real disservice. So I hope I've been able to get across to your listeners how important periods are and why they're so important. And this pubertal change that starts to occur is because of a trigger in the brain where there is a center called the hypothalamus. The hypothalamus releases hormones called gonadotrophin releasing hormones. So they then will trigger the pituitary gland, which is another gland in our brain that produces wonderful hormones called luteinizing hormone and follicle stimulating hormone. Hormones are chemical messengers. They are messengers they're like little magicians. Basically, they work, they are produced in a distant organ and then they work in a different place. So they produce in the brain and then they go in the bloodstream and work on your ovaries or on your thyroid or, pancreas will work by releasing insulin. So it's very fascinating to understand. So this trigger of gonadotrophin releasing hormones that then trigger luteinizing hormone and follicle stimulating hormone will then trigger the ovaries to start producing progesterone, estrogen, and testosterone. And actually women in the reproductive age group, that means between the ages of 10, 12 till 50, actually have 3 times more testosterone than they have estrogen. So testosterone is not a male hormone. Testosterone is found in women as well, and it plays a very important role in muscle development, bone development, and men also have estrogen. So it's not as if this is a male hormone or a female hormone. It just depends upon what age you are, what gender you are, and how it fluctuates throughout your life cycle.
Well, beautiful. I think you clarified the role of hormones and that it's not just one sex alone that has it, right? There's so much stigma around it to even refer to the hormones as, either male or female.
Exactly.
And it's amazing how you explain the role of prostaglandin and the activity and why period pain occurs in the first place. So, is it all right for any listener that wants a clarification here to take those medications past the first day, or is it something that should not even be lasting more than one day, the sort of the pain and the
So it
inconvenience?
depends upon the level of activity. We know that if you're active at least 3 times a week or 45 minutes, if you eat a diet that is full of lots of fruits and green leafy vegetables and beans and whole grains and nuts and seeds and herbs, you're physically active, you would expect your period pain to start maybe the day before you have some mild cramps, and then maybe the day 1 or 2. If you're somebody who's needing to take prolonged medication, if your pain is lasting for days before your period starts and then days into your period, anything that concerns you as a parent or as a listener, please don't ignore it, because there is help available, very good help available. It's important to understand your own body. Have things changed? Has it got worse? Has it got better? So I have a whole chapter, I think, where I say nobody knows your body better. And it's shocking, even in London where I live. There was a recent survey, 1 in 4 women didn't know where their vagina was. 1 in 2 don't know where their cervix is. 1 in 10 don't know where their entire reproductive organs are. And that's not the fault of the person. The fault lies with education. We're not having sex education and detailed information in schools, and we just sort of skim past it. We're not comfortable using words like vagina and vulva and things like that. It's really important. And if you actually don't know the different parts of your body, what happens is very difficult to articulate when you go to the doctor, and the doctor may have only 10 or 15 minutes for you. And so when you sit in the chair, you forget many of the things you want to say, right? And so what happens is you go to see the doctor, you're overwhelmed. And then when the doctor starts asking you questions, you haven't prepared. So I always tell my patients, prepare, read about the doctor first of all, find out, if this is the right person for you, whether it's a family doctor, whether they need to be empathetic, they need to listen to you, they need to spend time with you. And it's okay to go with questions, because you have, as I said, you have to invest in your health. Nobody else is going to worry about it as much. Also make a list of questions for yourself. Know when your last period was, know when your first period was, know what your menstrual cycle is. Whether you're going for an orthopedic problem or a diabetic problem, doesn't matter. Make a note of your reproductive health history. The number of children you've had. Are you trying for a pregnancy? What contraception do you use? When was your last pap smear? What medical history have you had? Which doctors have you seen? Have you had any surgery before? Do you have any medical notes? All these things put you in a position where the doctor will then look at you and say, this person knows what they want or talking about, and I'm going to give them the full attention. It's a sad world, because everybody should get the attention, whether they can speak the language or not, or whether, that doesn't matter. But you have a responsibility to yourself. And that's why I want people, and that's what we talk throughout the book, what sort of questions should you go ready with? Why should you do that? Why is it so important? Doctors are overworked. They're not bad people. We are working for our patients. But when you are seeing hundreds of patients, sometimes 100 patients in a day, you will then start taking, shorter cuts. So it's really important. And you give more time to the ones who are more demanding. And I would tell your patient, be more demanding. It's your body. You need to ask.
That's where advocating for one's care becomes
Always
important,
advocate
right?
for yourself and be reassured. Don't ask for unnecessary, silly tests when you're not needed. But that. Whether your doctor's just running a battery of tests when actually they don't need to. And you also know when the doctor is dismissing you when there is an issue. People's intuition is pretty good. When you can trust your doctor and, your other health professionals. So, but educate yourself, empower yourself. If you don't do that, you'll find that you're sort of sometimes in the wrong place.
Oh, yes, absolutely. I could not emphasize more on this show the need to advocate for one's own care. And I have my own health journey, and it's just, so important that we ask the right questions and be more prepared going in for the appointment. And you have said that beautifully in the book as well. And coming to PCOS, the highlight of this conversation, if you will, your beautiful book again. So if we can start with what PCOS is and why does this condition even manifest in the first place, I think that'll be wonderful for the listeners.
And just a little rewind, because I've been seeing 4,000 patients a year for several years. I have now tapered down my practice. So I have seen a lot of people with polycystic ovary syndrome. But initially, because I have a very wide experience, I'm a robotic surgeon, I'm a laparoscopic surgeon, I've done all kinds of things. I have interest in complex vulval problems, menopause. I initially started writing a general book. And my daughter, who actually is living with PCOS and who's a nutritionist, had taken control of her condition with my help and with her own research. And so when she heard that I was writing a general book, she said, "Mom, why are you writing a book that is general? Because really what we should be writing on is all these, you keep coming back and telling us all these wonderful stories of how your patients have either gotten pregnant or, have got their periods back or their acne is better. And I have been living with this condition. Why don't you do a deep dive in a condition that really is not spoken about, is so stigmatized, especially in the Asian community? So why don't you write something about PCOS?" And initially I was going to write a 100-page book. And of course, it's 472 pages. And the reason it is, it's got lots of references, it's got lots of recipes, it's got a 21-day plan, but it's also done a deep dive. So you don't have to read any other book if you want to regain your hormonal health. And so while this book is for people with PCOS, it's also for partners who have people with PCOS, or mothers or parents, as well as even if you have other medical conditions, painful periods, endometriosis, fertility issues, if you're confused about soy, if you're a man and you're worried about your type 2 diabetes, this book will actually help you, because there are big chunks. Part 2 and part 4 is relevant for everybody. Part 3 dives into things like acne and all that. So that's the background as to why we wrote the book. And I absolutely love the journey. A lot of people say they find it very stressful. Actually, Rohini, who is my older daughter, she wrote the book. She did part 4. I did first 1, 2, and 3. And she kept sending me back to the drawing board saying, "Mom, you're talking too much like a doctor." And so avoiding medical jargon is so important for our patients. So polycystic ovary syndrome, or PCOS, or polycystic ovarian syndrome, or PCOD, polycystic ovarian disease, are all one and the same thing. Because often in India, where you and I both are from, it's often referred to as PCOD, and they try to make a differentiation. Actually, it's not a disease because we don't have a single cause. So it's not like tuberculosis or polio or COVID, where we know the actual cause, a bacteria or a virus and things like that. This is a constellation of symptoms, and there are many possible theories, of which insulin resistance is one. So that's why it's a syndrome and not a disease. So polycystic ovary syndrome is a slight misnomer, because actually there are no cysts in the ovaries. What is it? It is the most common, and I'm highlighting this again, most common hormonal disorder or endocrine disorder. Remember the hormones we talked about? That's the endocrine system. Is the most common, more common than thyroid problems, more common than type 2 diabetes in the reproductive age. It's the most common hormonal disorder to affect women in the reproductive age, which is, again, we said from the time you start your period till the time you stop your period. So that's the time when you can have a baby. That's what reproductive age means. So it is the most common hormonal disorder, but it's not a disease of the ovaries. It affects the function of the ovaries. There's nothing wrong with your ovaries. It's just full of immature egg follicles that you're born with, and none of them are winning the race every month to release that egg that is supposed to be released, which is why you have symptoms like missed periods, irregular periods, or no periods. And that is because of this situation called anovulation or oligo-ovulation, which means that your ovaries, which are these 2 egg baskets that you're born with all the eggs that you're ever going to have. You're not like sperm, which is made every 72 days. You're born with the eggs. So that basically then gets released. 1 egg gets released usually, sometimes 2, but usually 1 egg gets released from either ovary. It's not like left ones, right ones. It gets released, and then 14 days later, a period starts. So every 28 days, roughly between 24 and 35 days, you have this. And ovulation tends to occur 2 weeks before your next period. But
so that's the ideal cycle.
Cycle. But in anovulation, oligo-ovulation, which is one of the hallmarks, most people have not heard of PCOS. It affects 1 in 10 women. So it's that common. And in Asian communities, Hispanic communities, those who are carrying excess body weight, those who are having difficulty to conceive, the incidence is 1 in 4 as much. And the most important, and the thing that saddens me the most, is 75% of women will never get a diagnosis of PCOS. So polycystic ovary syndrome, or PCOS, is the most common hormonal endocrine disorder to affect women in the reproductive age group. It affects 1 in 10 women, but 3 out of 4 women will never get a diagnosis. And $8 billion was spent in the US last year because of complications in women with PCOS from pregnancy-related complications and type 2 diabetes-related complications. $8 billion. And it still is not spoken about. It's still not a public health issue. It's still a lot of stigma. Why does the stigma come? Because it's the most common cause of infertility. It also causes this missed periods. It also causes adult acne. So cystic acne, acne on your chin, acne on your back and neck, excess hair growth where you have to remove the hair almost daily, especially in the chin area, between your legs, on your chest, on your back, hair loss, excess body weight, infertility. That combination makes parents very anxious. They don't want to tell anybody that their child has got PCOS, and it starts in the teenage years. And you'll hardly see any celebrities talking about PCOS. They will talk about endometriosis or other things. They don't talk about PCOS because
it is stigma around.
And that is why we wrote the book, to break down this stigma. We wrote the book. The book itself is pink in color, in a nice pink that any man, woman can carry it around on the train, in the bus, and is non-gendered, in fact, and we've kept it without, we've kept lots of pictures, but black and white, about your body and mythbusters and things, and case studies and recipes and all, but we've kept it without color inside so that it is cheaper and accessible for everybody to read. And we're giving it to libraries as well, so that people who can't afford it hopefully will be able to, go to your library and say, please, can you order this book? Because libraries are very good. They like to order books in, and they will do that. And then if you finish reading it, you can always pass it. If you have bought it, you can pass it on as well.
Okay, fabulous. You said it typically trends or starts around the teenage years, correct? Yes. But is there any possibility that someone can have it anytime in their life? Yes. And I know in the book you write about it goes all the way from whenever it starts to menopause or Correct. Even after, right?
Correct. Yes, but if you look deep enough, because there's so much of genetic background to it, we think it may have been missed in the adolescent time. And that's why we wrote a whole chapter dedicated to teenage PCOS, because you have to wait a number of years. You also cannot use an ultrasound scan because these little follicles look like cysts, but they're not cysts. Cysts are fluid-filled follicles. And PCOS is a diagnosis of exclusion, which means you have to rule out other more serious conditions as well. But ultrasound is not useful in teenagers to diagnose because teenagers also have lots of little cysts in their ovaries and known as multicystic ovaries. So they have to have both the androgen excess, which is excess hair growth or acne or hair loss, as well as delayed or missed periods. So what happens is often they will go, or the family themselves might think, it's quite normal for my daughter not to have periods, but we know that teenagers may be putting on much more weight than their friends who may be eating the same foods, for example. So there are a lot of triggers that are often not picked up on. And so then they found out almost always, my heart breaks because I see a lot of patients who've been told by their health professional, go away, come back when you want to get pregnant. And so most of the information starts coming out only when you start trying for a baby. Not everybody wants to have a baby. It's not a woman's life purpose only to have children and to reproduce. Having acne that doesn't allow you to socialize, having to have excess hair growth, that you're spending so much money on laser, bleaching, waxing, threading. You have all the psychosocial issues and anxiety and depression, which is also under-recognized in PCOS, binge eating disorders. And people are often told by our health professionals, not necessarily in a bad way, but they'll tell them, go lose some weight. Now, if you're having an eating disorder, that doesn't help. Whatever diet you may be, you have to look at the behavioral change, how you have to talk to the person. So, Yes, it can occur. It can manifest if your lifestyle. So you may have a genetic tendency and you may have been, not living a very stressful life. Everything may have been okay. You've had a couple of kids, then you start having a unhealthy relationship and you start eating unhealthy foods. Then yes, PCOS can start manifesting because you've started putting on a lot of weight. And so, yes, your question is right. But I think if you look back and you spend a bit more time, because I like being a detective, that's what medicine keeps me so excited about, is that you'll actually find triggers well before. It's just that nobody's looked at those clues. And it's all about looking at clues, isn't it?
Yeah, sure. And you talked about, the genetic aspect. And there's this Rotterdam criteria that you write about in the book.
Yeah.
Why don't you tell us about that? We already touched upon period being a fifth vital sign almost, right? That's kind of how much importance and significance one should attach to that. So what would be the symptoms that would warrant someone to seek medical help?
So if you are missing periods, delayed periods, your periods are, not coming as they should in that 24 to 35 days, they're coming too frequently. It may be that you don't have PCOS. Yeah. Any period issues that cause you concern, you need to be seeking help. But if you're thinking you may have PCOS, as I said, it may be because of anovulation or oligoovulation, where you're having missed or delayed or irregular periods. You may be having acne, excess hair growth, female pattern of hair loss. You may be putting on weight much more quicker than you thought you should be. If you're having difficulty in conceiving, these are all things that will trigger you to go to see a doctor. There are other less known symptoms like anxiety, depression, binge eating disorders, sleep problems, daytime sleepiness, sleep apnea. These are all lesser spoken of, darkening of skin, insulin resistance, which is one of the main drivers. So genetics, when you ask me that question, we do know that there is quite a significant genetic component to the condition PCOS, just like type 2 diabetes. So for your listeners, the easiest way to understand PCOS, it's a cousin of type 2 diabetes. So the way to be aware is if you have a family history of type 2 diabetes, if you have a mother or a sister who has type 2 diabetes, if you have a father or a brother who's got frontal hair loss, early balding, and has got high triglycerides, because men can have the characteristics of PCOS too. If you're having these things or if you're concerned, you should seek help. Why? Because genetics does not seal your fate. Genetics just loads the gun, but it is your lifestyle that pulls the trigger. So it's really, really important that you actually seek help from somebody who understands the situation. And I'll tell you something why. One of the main issues why it's so difficult to diagnose is because a young person may come to see me because of irregular periods, because I'm a gynecologist. They may go to see a fertility specialist because they're not able to have a pregnancy. They may go to see the endocrinologist because of insulin resistance. Their body is not processing the insulin and so sugar levels are going high. They may go to see a beauty therapist because they need laser treatment. They may go to see a dermatologist to see for their acne. They may go to a therapist for their anxiety and depression. Or a psychiatrist. They may go to a dietitian for weight loss. They may go to a sleep specialist for their sleep issues. So you can see how many health professionals may end up being involved. And if nobody is asking all the relevant questions, this poor person is spending so many dollars not getting a diagnosis. So nobody's going to the root cause. They're just having their hair removed or just going on raw Accutane for their acne, or just going and having fertility treatment and developing gestational diabetes and diabetes during pregnancy and things. Nobody's actually talking to them as to there is a common cause here. Let's work together. Let's work together with medication, with some supplements, but most importantly with behavioral and lifestyle changes.
Yeah, it's almost like one is thrown from pillar to post, and because no one is able to just get to the bottom line and narrow down.
Correct.
And that's where you write about this Rotterdam criteria.
Yes. Yeah. So the Rotterdam criteria was a group of experts that sat together many, many years ago, then in 2003, and then they've confirmed it in 2018. And basically the three criteria, you need 2 out of the 3 if you're an adult. What does that mean? That means you have to have either signs of anovulation, which means you're not producing eggs regularly, which means that you have either delayed periods, missed periods, or irregular periods. That's one criteria. The second criteria is signs of excess androgen excess, which means either you have high levels of testosterone on your blood tests. There are, certain blood tests that we recommend, and I talk about it in the book. Or you have acne, adult acne after the age of 25, or cystic and nodular acne, excess hair growth on those unwanted areas. Especially, we're not talking about mild hair growth. There's a lot of societal obligations, societal expectations to be this very smooth like a dolphin. That's not how women were ever meant to be. But I'm talking about hair growth that is, of concern, acne, hair loss. Those are signs of androgen excess. So if you have both those, then you have polycystic ovary syndrome. If you have missed periods and you have an ultrasound diagnosis as an adult with these pearl, I'm wearing a little necklace, like a pearl necklace. It appears, these immature egg follicles appear under the surface of the ovary like a rosary or a pearl necklace. And there are certain criteria on an ultrasound scan that have to be fulfilled. You've got to have, in the latest type of scan machines, which are very high resolution, 20 follicles that measure between 2 to 9 millimeters. And the ovarian volume is also bigger than the average ovary. So if you have two of those things, so you can have blood tests that are androgen excess plus irregular periods, or you can have acne plus irregular periods and you have a diagnosis, or you may have excess androgen excess plus the polycystic ovaries on ultrasound. So 2 out of the 3. Many people will have all 3, but at least 2 out of the 3 have to be there. That is the Rotterdam criteria. Now, we don't like to differentiate the different types of PCOS. Some people will say there's type 1, 2, 3, 4. We don't like to do that. That's for research purposes. It confuses it because management is the same. But for teenagers, why? You have to have, ultrasound is not useful. You have to have signs of androgen excess. Androgens, by androgens we mean testosterone, is the most commonly known, and all women produce testosterone in different amounts, and it drops as you get menopausal. The ovaries produce testosterone, your adrenal glands produce testosterone, but in PCOS it may be that the amount of free testosterone is running around in your body much more, even though your overall levels may be normal, because there are certain proteins produced by your liver that actually drop, and which can be improved with either the hormonal contraceptive pill or with having a diet that is very rich in vegetables and fiber. So it's just important to know that 2 out of 3 for adult diagnosis of PCOS according to the Rotterdam criteria, and 2 out of the first 2, so clinical signs or lab signs of androgen excess, not ultrasound for teenagers.
Okay. But the ultrasound becomes relevant in case of adults, correct? Not the adolescents.
No, but adolescents, sometimes you will do because it's a diagnosis of exclusion. So you're not doing it to diagnose PCOS, you're doing it to rule out a big ovarian cyst or ovarian tumor or something like that. That is the situation you would do it in, not to diagnose PCOS. Polycystic ovaries are not a feature of adolescent PCOS, not for 8 years until after starting your period.
Okay. And is there like a 8-year time period post the first period?
Yes. So say you start your period at the age of 13, really until 21, you shouldn't be having an ultrasound to diagnose you with PCOS. You understand? Because remember, ovaries in teenagers will look multicystic or polycystic or whatever. That is the natural look of ovaries, because a lot of immature eggs are present in the ovary in a young teenager. So that's why we wait for 8 years to make that final diagnosis. But that doesn't mean to say that we can't diagnose PCOS if you have those first 2 criteria, not having periods or missed periods, and signs or lab evidence of androgen excess, which is, acne, hair growth and things.
Okay. So there's the reproductive side to PCOS, the metabolic and the psychological, and you reflected upon body image. There's so much because of the social stigma and whatnot. There's so much body image issues and mental health, right?
Mental health, absolutely. So we know that there's a higher incidence of OCD, obsessive compulsive disorder, higher incidence of taking your own life, having binge eating disorders. So what happens is you don't necessarily purge. So in bulimia, you tend to purge. And in anorexia, you do severe calorie restriction. In binge eating disorders, you eat a lot of food. And so you are having an eating disorder. You can't control it. But because you are living in a larger body, 8 out of 10 people with PCOS may be living in a larger body. So your doctor will tell you to go and lose weight without realizing there's a psychological issue here. And so that is why it's so, so important to navigate this properly, because just telling somebody to go and lose weight, everybody knows how hard it is to lose weight. And those are not healthy goals. So we always tell, and throughout our book, we've always said, don't focus on losing weight. You can lose weight with a number of bad diets, keto diets, paleo diets. You can lose it with, which are full of saturated fat generally and animal foods. Or you may also try and lose weight by smoking and, excess alcohol and drugs. These can all make you lose weight. That's not a healthy way of losing weight. You're going to lose weight in a sustainable manner. But if you tell somebody to lose weight, invariably every study has shown that you put the weight back on in a couple of years. So how do you lose weight sustainably? What you do is you ask the person to focus on other things. What is important to you? Why do you want to do this? So they may say, I want to have children. Okay, let's focus on that as a goal. Others might say, I want to get more fit. I want to run a marathon. I want to get my acne better. I want to have less hair growth. I want to be less anxious. These are better goals to focus on because they're more achievable rather than a weight loss goal, because that people think just by exercising you can lose weight. You can lose hardly any weight unless you're exercising like Usain Bolt. You've got to. Exercise is great for normalizing your hormones, for making your insulin resistance better, making your tissues more sensitive to insulin. It is great for your mood. It's great for toning your muscles. It's great for lowering your risk of cancer, but it is not good for losing weight. So, and that is a sad pill that is sold by many, many gyms, and people wonder why they've gone and walked on the treadmill for an hour, and then they haven't realized that they're eating calorie-dense foods that just will not help them on their journey at all. So it's really focusing on the kind of goals which allow people to optimize their general health. And then as a side effect, as a positive side effect, they notice that their weight is dropping off. Does that make sense?
Oh, absolutely.
Back in a moment with our guest on Freshly Forever.
And actually, let's focus on lifestyle changes in a minute. But before that, PCOS also gets confused with premature ovarian insufficiency, correct? That's also something which we need to, offer clarity here. And you mentioned genetic component, but then there's so much science now, there's epigenetics now, and that's where this lifestyle changes come in.
Yeah, correct. So POI, or premature ovarian insufficiency, I actually went through that myself at the age of 38. My period stopped. So periods when they stop under the age of 40 is known as premature ovarian insufficiency, previously known as premature ovarian failure or premature menopause. We don't like those words very much. And after the age of 40 to 45, it's early menopause, and between 45 to 55 is the average age range of menopause. And of course, symptoms start much earlier, known as perimenopause, when you're approaching menopause. There's actually no confusion between PCOS and POI or early menopause and things, because the only thing in common is you're missing periods. So that is why we do all the right tests. Because we want to make sure that, remember what I said, PCOS is a diagnosis of exclusion. So you want to rule out somebody's pregnant, somebody's not having early premature ovarian insufficiency or early menopause, somebody is not having an ovarian tumor or an adrenal tumor, or conditions like non-classic congenital adrenal hyperplasia. So there are many other conditions, which is why we do these tests. But it boils down to the health professional taking a nice detailed history, making sure that the person is along with them, understands everything that they're asking, and why they're asking is not to stigmatize, is not to shame, but it's to actually find out, and then run the right tests, which, as we explain in the book, the right blood test, the right scan, so that they can then present the person with the right diagnosis. So you can then start empowering yourself and thinking, what can I do? And every international guideline has talked about the first line has to be behavioral and lifestyle change, which makes me very happy. What makes me very sad is they don't tell you what lifestyle changes. So the person who's sitting, the patient, every international guideline group has a group of patient members as well. And they all come out saying, It's all very well people being told to have a healthy lifestyle, but what does that look like? So that is why, and we know we have so much information from type 2 diabetes, which is a close cousin of polycystic ovary syndrome, that the earlier you can bring these changes in, even when you're pregnant and your baby's in the womb, you can bring those changes, because epigenetics, the genetics, that the controllers that sit on top of the genes, can actually influence how your grandmother was eating or behaving, can influence the grandchild. So it is fascinating, epigenetics. And we talk about that. So it is never too late and it's never too early. You may be 80 years old and decide to change your lifestyle, and you may be 10 years old or 5 years old or a baby, and your parent might help you to make better lifestyle choices. So that's what I want your listeners to understand. It's never too late and it's never too early. And the same lifestyle that helps PCOS helps you to prevent diabetes. Manage diabetes helps you to manage and prevent and reduce the risk of many cancers like breast, bowel, ovarian cancers, prostate cancers. It also helps you to reduce the biggest killers like dementia in women and heart disease, as well as, many of the top 10 killers are chronic illnesses. So there is no different lifestyle to look younger. There is no different lifestyle to treat endometriosis or painful periods or PCOS or diabetes. It's the one and same. It's just learning to understand what that looks like.
And what about insulin and insulin resistance? Most people tend to, again, get confused with those as well. And it almost seems like PCOS and type 2 diabetes, they go so much hand in hand. And is there a predisposition to one if you have the other?
Yes. So we know that so many people with PCOS, especially if you're carrying excess weight, by the time, if you get pregnant, you have a very high risk of pregnancy-related diabetes. And that's a big warning sign if you have had gestational diabetes. But we also know that by 40, over half the women living with PCOS will develop type 2 diabetes. And so because the main driver of polycystic ovary syndrome, other than genetics and, excess weight, the main 50 to 70% of the main reason why people get PCOS is insulin resistance. That means your pancreas, which is this tail-shaped organ producing insulin as a hormone, what happens is it's not able to do its job because the cells in your body, in the liver, in the muscle, in your body are blocked usually by fat coming from the diet especially, and from your body fat. The job of insulin is to work on glucose that once you've eaten a banana or rice or bread or any food, because without glucose, our body can't function. Our brain runs on glucose, our muscles, everything needs glucose. That's why you have a pasta meal before you go on a run. So it's really important to understand that avoiding carbohydrates is not the solution. You have to understand how to eat sensibly. Why? Because these insulin levels are supposed to move the glucose that has been broken down from the foods that you've eaten into the cells so that they can then start making the muscles work, the liver work, the whole body work. But if that cell has got a key, which is basically blocked with chewing gum or saturate or fat, then what happens is the lock is blocked with fat. Insulin is the key can't do its job. So you got to melt that fat. How do you melt that fat? Yes, by trying to make lifestyle choices that will help to make the tissues more sensitive to insulin. And how does that look? You have to look at all 6 lifestyle pillars. Why? Mm-hmm. So what are the 6 lifestyle pillars? We start with nutrition, because we know that the more foods that you include in your diet that are whole plant foods, which means a lot of fruit. So fruits are very healthy. Fruit juices are not. So fruit has its fiber. And so it basically brings the blood sugars down when you eat the whole fruit. So you want to eat lots of fruit. We know more fruit you eat, lower the risk of diabetes, lower the risk of diabetic complications. So you want to eat a lot of fruit. You want to eat a lot of vegetables, especially green leafy vegetables that open up the arteries and help your ovaries to get healthy. You want to eat a lot of whole grains, things like brown rice, red rice, millet, amaranth, quinoa and things like that. You want to eat a lot of beans, lentils, soy, tofu, edamame beans. You want to have dals. You want to eat those foods because they're all anti-inflammatory foods. I have a whole chapter dedicated to soya, but soya is very safe and very good for hormonal health, both for men and women. And I have a free fact sheet on my website as well. So please go and read it. There's a lot of scientific evidence and no negative scientific trials, not one, Okay. And we also want people to eat nuts and seeds and a lot of herbs and spices as well. So plant-based nutrition, the more plants you can eat, the better it is for your health. The less of what foods should you not eat. So most Americans have 60% of their diet is ultra-processed foods, like in the UK, like now in India. So you want to be eating less processed, whole foods, minimally processed foods, okay? You want to be avoiding animal foods. Eggs, fish, meat, chicken, dairy are not your friends. You eat them as if you should be eating a piece of chocolate cake. Why? Because they basically increase the amount of receptors in the ovary that react badly, something called advanced glycation end products. Advanced glycation end products are glycotoxins that damage the tissues, damage the ovaries, and they come mostly from animal-derived foods, barbecued foods, fried foods, cereals and things. So you're better off having mushrooms with brown rice and a lot of green leafy vegetables and legumes and dals, which really bring those advanced glycation end products down. So after nutrition, if you're eating well, what happens is you tend to want to exercise. And when you exercise within half an hour of eating a meal, what happens is that your insulin becomes the tissues become much more sensitive to insulin. So insulin sensitivity improves with exercise. Mm-hmm. All kinds of exercise, dancing, going for a walk, doing strength training, skipping, anything, that weight training, all these exercises, anything. You don't have to go to a gym for this. And then when you exercise better, you tend to sleep better. And how do you sleep better? You want to have at least 7 to 9 hours of sleep, because during the sleep, what happens is your cortisol levels drop, your anti-inflammatory agents tend to increase, because during sleep, all the junk is moved away. Your brain gets better. And so if you have sleep deprivation, cortisol levels rise, you tend to put on more weight, insulin resistance gets worse. Glucose control gets worse. And that is why it's such an issue in PCOS, because women have snoring, sleep apnea, which is all very serious situation. So nutrition impacts on exercise impacts on sleep. When you sleep better, you stress less, so your cortisol levels drop. When you stress less, you don't want to smoke or drink alcohol, which actually worsens your condition of insulin resistance as well. And then when you do that, you also want to be hanging out with your friends and laughing and doing community work and having a purpose. So these 6 pillars, if you neglect one, all the other 5 get neglected. Similarly, if you boost one, when you exercise more, you want to not eat the donut, you would rather have the mango. When you eat the mango, you want to, look after your health, you want to go to sleep earlier, you want to ring your friend and talk to them, go for a walk, and you want to stay away from the alcohol and smoking. So you can see how it's like a domino effect.
Yeah, everything is so linked in, it's just it's a rippling effect.
Yes. And I think the mistake we made as doctors, and we still make as doctors, is we were never taught the importance of lifestyle. And so that's why I want people to know it's not one or the other. You may need medication, you may need fertility treatment, you may need the hormonal pill, you may need diabetic medication, you may need certain supplements, but you need lifestyle always. Doesn't matter what you do. Lifestyle alone may be enough. All those dietary and lifestyle changes and behavioral changes. Always change the way you talk to yourself, self-care and self-love. A lot of people with PCOS talk to themselves in a harsh way. And I always say, talk to yourself as if you would talk to your best friend. How would you talk to your best friend? Would you use the same words that you're using? And so we have a whole chapter on affirmations so that people can start talking to themselves nicely. Because when you talk to yourself nicely, you tend to do better. And also you will have sometimes friends who bring you down. So try to have people around you, friends and family, that support you. And if somebody says, come on, today you can have the samosa, or today you can have a glass of wine, or today you can have that chicken, all you say is, it's not that I can't have it, I just don't want it. Or today I'm not eating it. Today I'm not drinking. So then they feel, oh, today she's not doing it because today she's doing some fast or religious thing, or today she doesn't feel like doing it, rather than, oh, I'm on a diet and things like that, because people want to sabotage that. So always change the word. Instead of saying I can't have it, because I just say I don't want it. That completely is you are in control. So living PCOS free, the name of our book, does not mean that there is a cure for PCOS. There is no cure for polycystic ovary syndrome, but you can be in control of it rather than the condition being in control of you. You can empower yourself with the information and then make the changes and help people around you to, support you and lift you up rather than drag you down.
That's fabulous. What about the role of fiber in warding off this excess estrogen?
Yes. So fiber is really important for all, whether you want to reduce heart disease, whether you want to reduce high blood pressure. And fiber, why is not present? Anybody who tells you that fiber is present in anything else, no, it's only present in whole plant foods and minimally processed plant foods. So you will only find
none in animal foods.
Zero, nothing in eggs, nothing in milk, not dairy milk, nothing in fish, nothing in meat, nothing in most highly ultra-processed foods, very minimal in those. So fiber is needed to trap the excess estrogen that is produced by your body fat. And so any excess, it doesn't deal with anything to do with the normal levels of estrogen. Like soya, it tends to work only on excess stuff. Nature is it's like a magician, isn't it? Nature knows what to do. So it takes this excess estrogen and throws it out of the system. When the fiber is not there in your diet, if you're not eating dals and beans and fruits and vegetables, this estrogen that is excreted out into your gut gets reabsorbed into your liver, the enterohepatic circulation. So as a result, what happens is you have even more estrogen coming through instead of getting excreted in your poop. So fiber is so, so key. And I think we speak a lot about fiber throughout the book and why it is so important. And the 33 recipes that we have really focus on you getting your fiber in, because people in America and in India and in the UK women get only about 15 grams. They're supposed to get double that, and in fact, our ancestors ate mostly roots and vegetables, not meat. Our gut has evolved to digest fiber and to move that fiber along, without fiber and all the gut bacteria cannot actually flourish. And you need those friendly gut bacteria, not the unhealthy ones.
Mm-hmm. And what about the role of the combined pill? I know so many people struggle with acne. So many people struggle with acne.
Yeah, there is nothing to be afraid of the pill. You may need it for contraception. It's highly effective. If you don't need it for contraception, you may need it to reduce. It's the first line treatment for acne and the first line treatment for excess hair growth. But as I said, lifestyle always has to come through. And the pill is very, very safe. It protects you from taking it for at least 4 years, halves your risk of ovarian cancer, womb cancer. If you take it for much longer, you can have a slight increased risk in breast cancer, but that's really small. It goes away as soon as you stop it. But also, it's a very highly effective contraception, but it can't be used in somebody who's trying for a baby, for example. So we do a lot of myth busting on the pill as well. And on my website, neetubajekal.com, as well as in the book. One is often scared without understanding, like people are scared of hormone replacement therapy. Actually, there's no reason to be scared. We've got very robust studies for years and years and years and years, especially with the combined hormonal contraceptive pill. We have got lots of information, and you don't need to take it with a break every month. You can take it back to back. And again, we explain all that in great detail. It's not for everybody, but it should not certainly be rejected as a very wonderful option for many people, because some people can't even step out of their house because of their acne and their hair growth. And so, the mental health issues are so important that you can't just say, oh, somebody told me the pill is really bad. No, who is that somebody? Mm-hmm. Where is their science coming from? Where is their evidence? You have to always talk from an evidence, not because Dr.
The need for trusted sources.
Yes, you can. That's why we have a whole section of all the trusted resources in the book, because it's not that you just listen to Dr. Bajekal saying it. Why is she saying it? What is her background? What are her credentials? Otherwise I could just be sitting on a podcast and saying, don't do this, take Dr. Bajekal's supplement, which I don't have, thankfully, and I don't plan to ever have. But, it's so important to understand what your source is. Do not put an influencer on the same level as somebody who has spent so much time with experience. And that's the mistakes we sometimes make, because somebody has told us soy is bad or the pill is bad. And that's why we wrote the book with so many myth busters. And then it's your own choice. Then you make up your own mind. Once you know the science and you still choose to disregard it, that's a different matter. It may not be for you, but you have to know the science. You cannot say the world is flat and expect me to believe it. Mm-hmm. No, not when the science says very clearly it's round.
Okay. And what about intermittent fasting? Can it play havoc with your hormones? And
sometimes,
because low fat stores can lead to missed periods, correct?
Yes. Intermittent fasting can help some people. But we always recommend, especially with PCOS, you're better to do circadian rhythm eating, which basically means like how you would have eaten many, many years ago. So you try and eat, say, between 8 o'clock and 6 o'clock or 7 o'clock in the evening, 8 in the morning to 6, 7 in the evening. evening. So you then have a beautiful intermittent fasting between 13, 14 hours, and that is perfect rather than going and any other fast. Of course, water fasts and other fasts do have roles, and we won't go into that. But for polycystic ovary syndrome, you may find that they have slightly raised cortisol levels and things. So that's why I always recommend eating your meal before 7 o'clock. We discuss all that in detail, and then going for a walk and things so that you can actually normalize your sugars and avoid the high peaks and things like that. So intermittent fasting does have a role, but probably not as great a role as one would imagine it to be. But again, as I said, it's very individual, and that would be individualized discussion.
Uh-huh. And you highlighted wonderfully the importance of plant-based eating and gut health and all of that.
Yeah.
Can PCOS possibly lead to other bowel-related conditions if gut health is compromised?
Yes. And that is with any health condition. If you are feeding your body a diet that is cutting out carbohydrates, you are actually shortening your life. So when I mean carbohydrates, I hate the word carbohydrates because people say, oh, I avoid carbohydrates. And that is such a sad thing, because we know that the people who live the longest have a diet of about anywhere between 40 to 55% of carbohydrates. And those are complex and simple carbohydrates that come in the form of fruits and vegetables, beans, nuts, seeds, herbs, spices, whole grains, soy. This is the sort of carbohydrates we're talking about. We're not talking about refined carbohydrates, cakes, biscuits, and white rice and white bread and things like that. You really should be eating foods that have fiber, tofu, tempeh, and things like that, rather than eating fiberless foods such as animal foods, because every time we eat about 3 to 4 pounds of food a day. So every time you choose to put a donut or a piece of chicken in your mouth, you're missing the chance of having a big bowl of oatmeal. You're missing the chance of eating tofu scramble or, oatmeal pancakes, or you're missing the chance of having a stir fry or a spaghetti with a lentil bolognese. We have the wonderful recipes in our book on breakfast and different things, including the Greek stew, which is one of my favorites. We've got simple Indian dishes as well, which are some of my comfort foods in a khichdi, but it's got a bump of edamame beans in it. And so, there is such a joyful way of eating. And don't forget, nobody has to go 100% vegan or plant-based. Vegan just tells you what you're not eating. You're not eating animals. Okay, or you're following a lifestyle that reduces the use of animal-derived products and animal foods.
Yeah, but you don't want to be junk vegan, so it's important to bring
Yes, so that's why it's so important to say what you're eating. So whole food plant-based explains to you the more plants you can introduce into your diet. That's all I want you to think. If you're eating 1 fruit in a day, try to eat 2. If you're eating 2, try to eat 3. If you're eating 3, try to eat 4. Grapes, mangoes, berries, apples, pears, bananas, watermelon, papaya, there is such a profusion of fruits that we can eat. Similarly with vegetables, you want to eat 10 to 13 portions of fruits and vegetables over time. So in a day, you want to eat 10 to 13 portions, but you may be eating just 1 portion. So you can't suddenly eat 10 to 13 portions. You want to be eating it, building it up over a period of 3 months. Now, how does that look like? A big salad or a big soup along with 3-4 fruits, because 1 handful or 80 grams, 2 broccoli florets is a portion. So it's not a huge amount. A big salad and a big vegetable soup and some fruit will cover your 10 to 13 portions. And similarly with try to bring in beans and legumes. So every day try to have things like hummus and dals and a bean stew or a minestrone soup. Or a lentil bolognese, things like that, so that you actually help to bring the inflammation down in your body and improve your hormonal health. So plant-based eating is very healthy. It is great if you go 100%, but you don't have to. But also remember that when you're eating plants and you're eating color, you are basically not only helping your own health, you're also helping the planetary health. You're also helping reduce animal suffering. So we are not human beings in isolation. So it's really important to think, how can I leave a better world for my children, for my grandchildren? That's what makes you realize why it is so important to think rather than just thinking of oneself. And also, it's such a delicious way of eating.
Absolutely. And you do advocate vitamin D, B12, and the omegas, correct?
Yes. B12 for anybody above the age of 50, or if you're on a completely plant-based diet. But even omnivores, actually 40% are lacking in B12 because we now feed the animals. B12 is not made by animals. It is made in the soil in microbes. So B12 we would recommend. Vitamin D, we know PCOS, especially and type 2 diabetics are often deficient, increasing the risk of COVID as well, but it's a hormone. Vitamin D is a hormone. D3 is a hormone. So we recommend that you take vitamin D3 supplementation. There are some other little tweaks that sometimes you need, but you can get it all through whole grains and legumes. But D3, B12, and omega-3s, algae-derived omega-3s, because fish actually don't make the omega-3. There's a lot of misconception, so
the fish feed on the algae.
Yes, the fish feed on the algae. So you want to take the algae-derived omega-3. But studies haven't shown definite benefit in PCOS beyond 6 months. But it's good for brain health. And so walnuts, chia seeds, hemp seeds. And we think that Asians are often better in converting from ALA to EPA. But you want to take a supplement as well, especially if you're thinking of getting pregnant, I think. So we have a whole chapter dedicated to pregnancy, to supplements. Literally, as I said, I don't think one needs to be looking at another book for hormonal health. And that is why we wrote it. We want people to feel empowered, that they can bring changes as much as they want to. I'm not going to be watching them. You're not going to be watching people. It allows you to be the person in the driving seat.
Oh, absolutely. It's just so comprehensive. And one last question, if you will, COVID and PCOS.
Yes. There was a lovely study done in the UK, a huge study actually looking at thousands and thousands of women. And they found that if you had PCOS, even though everything else was balanced for, so whether you had type 2 diabetes and excess weight, all that was accounted for. Despite that, just from having polycystic ovary syndrome, you had a 26% chance, I think, of having a higher risk of catching COVID. And of course, women tend to have long COVID as well. So that is why it is so important. And we know that those who eat a plant-based diet have shown repeatedly to have lower incidence of not just getting COVID, but also long COVID and other symptoms from the Zoe study. And also vitamin D3 deficiency can worsen it. We've got, I think, quite a big section on COVID and PCOS in the book when we talk about long-term problems with PCOS. PCOS can still linger on in the menopause and can also increase risk of heart disease, type 2 diabetes, womb cancer, COVID, all these kind of things. So, there's so much that, you need a whole day to discuss polycystic ovary syndrome, which is why the book is as big as it is.
Yeah, and even fertility, there is possibility of anyone having a baby. It's also something you clarify in the book.
Yes. And there is hope.
Yeah.
There is hope. Why? People often think, there is no hope. No, there is a lot of hope, which is why we said, and we have a lovely acronym of PCOS free that Rohini and I coined, and basically it involves, rest that is not sleep rest, that is R, and F is for fun, E is for exercise, P is for plants. So, there's a whole thing. And E, the last E, which is really what I love, is empowering oneself. Educate yourself, empower yourself, energize yourself and those around you, and you can then live the best life that you can and want to.
Mm-hmm. And you're such a big proponent of SO, and SO is good for any age group, even on a regular basis, correct?
Yes.
Okay.
Every day, daily.
Okay, wonderful, wonderful. I would encourage every listener to read this book, Living PCOS Free by Dr. Bajekal and Rohini Bajekal. There's a 21-day program that they offer in the book, and there's so much more resource and information that can empower one with handling PCOS or any condition for that matter. And in fact, living disease-free, I should say, because there's so much tips in the book regarding all of the hormones and everything. So thank you so much, Dr. Neetu Bajekal, for being on the show, and I thoroughly enjoyed this conversation.
Thank you. Thank you, I. Thank you for inviting me, and I hope your listeners have taken away some useful points today.
Oh, I'm sure everyone would. And if you would like to add any other contact information or anything else about the book and where one can look for it, I think that'll be great.
So it will be distributed in the US, and so you should be able to get it quite easily in the US. And so that's very exciting. There's also ebooks available, and always try to favor your local bookshops. Barnes and Noble as well, and then of course Amazon if there's no other choice. So I would say definitely you can get that, and I am both Rohini and I are very active on social media. I'm on Instagram as well as on TikTok, and I have a website that is completely free with at least 40, 50 different fact sheets, lectures, podcasts, recipes. It's neetubajekal.com, and hopefully you'll put all these resources at the bottom of your show notes.
Oh, absolutely. I'll include those in the show notes.
Thank you so much.
Thank you. Thank you so much for being on the show. Listeners, as always, follow the podcast, rate the podcast, and follow me on Instagram at YPKumar for all things digital media and lifestyle. Until next time, with yet another interesting guest and yet another interesting topic, it's me, Vi, saying so long.